Welcome back to Metabolic Mind. I'm Dr. Brett Scher, and I'm pleased to introduce this interview that I did with Matt Baszucki. Every time I interview Matt, it's really inspiring, and I hope you find it equally inspiring, because his story of how he used ketogenic therapy to treat and essentially put his symptoms of bipolar disorder into remission gives a message of hope to so many people and inspiration to so many people about what is possible. To hear his story, where he was, his psychosis and his mania, and when he was on his medications, how he wasn't thriving and he really was not himself, to finding ketogenic therapy, to putting his symptoms into remission and getting his life back, most importantly, and the things he could do, the higher level of functioning. And it was a level that his family was afraid he would never get back. But once they saw what ketogenic therapies could do, it changed his world, it changed their world, and they want everyone else to learn this as well, which is why we're putting this interview out there. Because to be honest, it wasn't meant to be for public consumption. This was a small, quaint family day session at the symposium on ketogenic therapy. And it was just me and Matt talking. Wasn't being filmed, except his mom, Jan, was filming it on her iPhone. So the quality isn't the highest level quality because she didn't know we were going to put this out there. She just thought it'd be cute to film it. But once we saw it, we thought people really need to see this. They need to see Matt, his poise, where he is now in life, the way he answers the questions. You would never know he ever struggled so much with bipolar disorder. As he likes to say it, sometimes he's more normal than any of his friends, which I think is kind of funny to hear him say. But that's why this interview, I think, is so powerful, because it was pretty much just a spontaneous conversation and not meant to be put out there. So I hope you enjoy it. Please understand the quality, though. And also please understand, Metabolic Mind is a nonprofit initiative, a Baszucki group, where we focus on the intersection of metabolic health and mental health, and metabolic therapies, like ketogenic therapies, as treatment for mental illness. But none of this is meant to be medical advice. We're not establishing a doctor-patient relationship. Using ketogenic therapies to treat medical and mental conditions can be very dangerous if done without proper supervision. So take this information, use it as inspiration, use it as hope, but bring it to your clinical care team to see if ketogenic therapies is right for you. All right, so now with that, let's get on with this interview with Matt Baszucki.
I'm curious about you. Why are you sharing so many vulnerable aspects of your life, and do you think it's brave?
Sure. I personally am with Hannah. I don't think it's that brave, but I can tell you brave for me is like going into a burning building as a fire person and try to rescue an infant. That's like what brave to me. But I can tell you that the reason that I'm sharing is because it just, for me, I'm sure there are so many young adults and adults who are going through these kinds of things, the mental health crises. And to qualify myself as someone who's really been through the ordeal in their eyes, and then also shown that I've recovered using metabolic therapies, ketogenic diet, as well as exercise and sleep hygiene and a few other things. To qualify myself is an important part of that. So for me, it's imperative to tell the story just for the sake of those people. And whether or not it mattered for me and my own future and, whatever that was, it didn't really matter to me, I don't think.
Yeah, and it makes a lot of sense. Now, the other thing you've been very open about is the number of doctors you saw, the number of clinicians you saw, the number of medications you were on. So give us a summary of the treatments that you've tried. How many medications, how many doctors, how many different things, and what did those treatments get you for treating your bipolar symptoms?
Sure, Mom, you want to chime in? We did so many things. I was in the psych ward a few times, drinking root beer. I did many treatment centers all over the country. I did TMS. We did all kinds of weird stuff that I saw dozens of mental health practitioners, psychiatrists, different people, therapists, etc. None of which helped me get well. So by the end, I had all of these manic episodes from 2016 to 2018 and psychotic episodes. I was in the hospital multiple times. But, in spite of all of this, the dozens of medications, the dozens of doctors, and all of these different things, I was never well, even though I was doing all of the things they suggested, like getting exercise. And until I found keto, at which point everything fell into place, nothing was really working.
Yeah, so is it safe to say that, a lot of the medications and the treatments can sort of help sort of with the mania and the psychosis, but you said you weren't well. So tell us what it means to you to be well.
Sure. So I was on like a real cocktail back in the day of antipsychotics and mood stabilizers and different medications. And they kept me out of mania. So that was good. And I have a love-hate relationship with the antipsychotic medication olanzapine to this day, which has saved me in many situations, but also could be causing me metabolic dysfunction. So I'm getting off it at the moment. But to answer your question, yeah, now that I'm only on a couple medications at low doses and doing keto and sleeping well and getting exercise and having good community and relationships, it's just a different experience of life from when I was on all those meds. And I've seen my cognition come roaring back as a result of taking care of my metabolic health and my mitochondria. I've seen it in how I read. I can read better. My executive functioning has improved. My chest rating, even things like that, have come back. So yeah, and I think for people who have who've gone through mental health crises, we can kind of feel when we don't have acute symptoms, but we're not well. And then we can feel, I know what it feels like to actually get well and feel better.
Yeah, I think that's such an important point, that the treatments, the acute treatments versus the chronic treatment and thriving. You mentioned your chess rating, so
yep.
So you competitive chess player, and
I'm not really competitive, but I do play. I played with a couple tournament players at work who are super strong.
Yeah.
And when I was on all those dang meds, I could barely play chess. I couldn't see the board. In addition to not being able to function in a lot of other ways. And, just taking care of my metabolic health, I've seen it come roaring back, really.
Yeah, that's impressive. So let's go back to when you did start on ketosis. Your mom, doing just hours and hours of research, was fortunate enough to find Dr. Chris Palmer and Denise Potter and learn about ketosis. When she approached you, were you sort of like, I've tried so many things, here's one more thing, a little hesitant, what is this ketosis thing? Or what was your sort of experience about starting?
I was actually very ready to do it when she approached me. And I think the reason for that was that I had been taking care of my health in a lot of other ways at that point. So this would have been 2020, around the COVID time, when I was exercising regularly, swimming. I was getting reasonable sleep, although not perfect. And I was taking medication as prescribed. I think I was seeing a therapist, psychiatrist, all this different stuff. I still wasn't well. I was still fighting the episodes that would come on periodically, and I would have to take extra medication to handle that. And so when you approached me about this, I was ready. I was like, let's do it. We have to do it. And I knew that diet had to be a component. I just didn't know what I was supposed to be eating for my mental health. It's just so unclear, and there's no, this is still a burgeoning movement. So yeah, I was ready to go when she approached me in 2020, and then I got on the diet in 2021 in January, and that's when everything kind of fell into place.
Yeah, so some people say, the lights turned on, it happened right away. Some people say it took, a number of months for it to sort of ramp up. What was your experience when starting ketosis?
Yeah, so I went on the diet in the beginning of January of 2021, and I remember it was a little rocky at first because there can be some mood symptoms during the first couple of weeks as people are entering ketosis for the first time. So I had to watch that, and I was working with Dr. Chris Palmer and Denise, who I don't know if she's here, but is she? Oh, hi, there she is. And I was watching my ketones, and I was very strict for the first few months. And every March I had been manic. We talk a lot about March madness, because as the days are becoming longer very rapidly in March, people tend to have mood disruption, especially mania for the type 1 bipolars. And I always had to take extra Zyprexa in March, 20 milligrams, sometimes more, to manage my mood. And I went through that March of 2021 on 5 milligrams of Zyprexa. I didn't have to increase the dose. My sleep was consistent, and I would always have 8 hours, 6 hours, 5 hours. It happened to me every time. And that's when I knew that something profound was happening. And then at that point, 3, 4, 5 months in, and I didn't have symptoms, and I was living normally, I knew something different was happening.
Were you sort of surprised? You thought, oh, here I've taken all these medications and all I had to do was change the way I was eating? Like, this is surprising?
I was shocked and frustrated that no one had told me about this sooner. And I think it's criminal. And I was put through the ringer of all these different treatments and meds and doctors and really horrific mental health symptoms. And all along, through all of that, there was this simple protocol that if I had just known about it and adhered to it, I would have gotten well, which was keto diet, sleep well, get exercise, don't drink, don't do drugs, and don't smoke cigarettes, and maybe meditate a little bit. And if I had just done that sooner, but I'm lucky I found it at 24. I mean, that's pretty early, all things considered.
Yeah, I mean, I think that's such a profound statement. You just said how frustrated you were that you didn't know about it sooner. All those years of trying different treatments and that's sort of, Metabolic Minds, our North Star of sort of what Jen has said, that she wants the information that she wanted, that she and you wanted to find out there, that we can provide that information. So, when we tell your story and people hear about what you have to say in your experience, what do you want them to learn from this and walk away with?
Yeah, good question. I would say I just want people to acknowledge keto as a viable treatment. And then more than anything, it's a question of living my own life when demonstrating that I'm well by working a job consistently, by showing up, by doing the podcast, being lucid on the podcast. And that speaks to me, I think that speaks more to people than just like all this talk. I mean, there's still a lot of work to do, and people, even mental health professionals, a lot of them won't even consider keto a viable treatment for some of these illnesses. And yet I've spoken with dozens and dozens of people anecdotally who report like incredible results from this diet and taking care of the metabolic dysfunction and the mitochondria in general and the effects on their mental health. So, and also, Brett, to just inspire the patients and that, this could work and that there is another way, and to not give up.
Yeah, I think that's a great point, to not give up, because we do hear so many times, I've tried everything, I give up hope. And I'm curious, did you ever get to that point where you're sort of like, I kind of give up, I don't know what else to do?
I don't know if I did, but my mom certainly didn't. And, my mom, Jan, she's even talked about people told her, well, you just have to accept it. And she just said, no, I'm not going to accept it. Are you kidding me? So I had my mom on my side, kind of pushing me to get well. And I still had a little bit of my tenacious spirit, even when I was on all these meds. So I never really gave up, although it was certainly disheartening for many years.
Now, we had this conference here over the past few days, and it was pretty impressive. There were at least 5 people with lived experience of treating their bipolar disorder with ketogenic therapies at this conference, which was pretty impressive. But even so, a number of the speakers talked about how this can be a quote-unquote restrictive diet and how we have to be, cautious about recommending a restrictive diet. Is it restrictive? What do you think?
It is restrictive. At the same time, there are a lot of foods that I can eat and that we can eat doing keto. If you walk into 7-Eleven, unfortunately, you're going to have a hard time finding like a large assortment of snacks that you can eat as a keto eater. But I do think I eat very well. I mean, I was just out to dinner with Hannah last night eating the butter with a nut, just like straight with no bread. So, I mean, and I can eat meat and coffee. So it is restrictive, but after the first 6 months when I got used to it and I accepted it, I was like, this is the way I have to eat. I think there's actually an element of freedom that comes from restricting my dietary intake, where I no longer had to think or have any cognition about my diet, because I always knew, okay, this is what I'm going to eat. This is the window during the day when I'm going to eat. And so I never even have to think about it, and it frees up mental space to tackle other things in my life. So, and I think there's something very beautiful about that.
Yeah, it's sort of like, put it in perspective, the restriction of food choices versus the restriction of how you led your life before when you weren't well and you didn't have, what you said, sort of the cognitive functioning capabilities that you have now. So is there is there anything you regret about this quote unquote restrictive diet, knowing the benefits that you've seen from it?
Initially, I regretted that I couldn't eat carbs. And carbs are really good. They're delicious. I think more than anything, especially, because I don't drink, I don't do any drugs, and I don't eat carbs. What I missed more than anything was the social element of eating with people when everyone goes out and everyone's either drinking or everyone's eating carbs together, having pasta, cultural festivities around food where everyone's sharing these moments together and I didn't get to participate. I would say more than the taste, as it were, that was what was the most difficult for me.
Yeah, especially since sort of the age group most affected by bipolar disorder is this sort of college, high school to college, the young adult, 18 to 25, where that's pretty prevalent. So it's something that people need to be aware of, that there are some social situations that you need to prepare for that might change, but the freedom from symptoms of mental illness may be worth it.
Yeah, I would say it's worth it.
Yeah, so looking back to where you were, did you ever think you would get to this point where you're hosting a podcast, where you've got a full-time job, where you're playing music again, where you're playing chess and doing all these things? Like, if we would have told you that 5 years ago, how would you react?
Yeah, so 5 years ago was 2018, and I would have been 7-8 months out of an acute manic psychotic episode, and my thinking wasn't even clear enough that I could comprehend this whole ordeal. I just didn't have any perspective about the situation yet. I would say, as I got better but didn't get completely well, the way I'm thriving now in my health, no, I never thought I would have anything like this.
Well, I know we have limited time. We got about 5 more minutes to get, because we could keep going.
Well, we could go all working.
So what other tips do you have for people who are thinking about trying this, who have been on multiple medications, who have been in and out of treatment facilities, and say, I'm going to try that, I don't know how? Do you have tips of how to get started that might have worked for you or you think might work for others?
Yeah, I would say really commit to it. When I started this diet in 2021, I was like, I'm all in. I'm just going to give this a 110% effort. And if it doesn't work, then it doesn't work. But at least I'll have known after that I tried it and I gave it my all. And don't get disheartened or don't get flustered when people have questions or even concerns or unsolicited advice about why your keto diet is not going to work and your cholesterol is going to get messed up and you're going to have all of this plethora of side effects and problems, and just ignore them and prove that you can be very healthy and very robust on this diet.
Yeah, I guess that's another thing to talk about is, you were lucky enough to work with clinicians in this field who knew about it and were experts, but you also had, your regular psychiatrists and your therapists who probably were a little questioning about this and whether it was a thing. Did you ever get some pushback that maybe you shouldn't try that?
I never got any direct pushback from my own little squad. I remember we had a call when I was doing this and everyone was on board. But I've certainly had pushback from just people in general who don't believe me. And I think the problem that most people have is, or most people misunderstand about my own treatment of this illness, bipolar 1, is that when they see me, a lot of people see me doing all this healthy stuff and they're like, oh, okay, keto's got to be 10% of the equation for him. And actually, I would say without keto, I have nothing. I could do everything else perfectly, tackle my sleep hygiene, handle the exercise component, take whatever perfect cocktail medications they prescribe. I think even, eating brown rice and potatoes, if I had not spent those 9 months in ketosis, I would not have the recovery I had. So I really try to stress that to people that keto has been the answer for me. Keto has been the answer for mental health, but I don't know if they believe me. I have no idea.
All I have to do is look at you and listen to you, and they should believe you. So thank you so much for sharing your story.
Sure. Thank you, guys.